Is an HIV cure possible? This is a question that's been on the minds of many for years. Today, we're going to delve into the world of HIV, its symptoms, and treatment options. To begin, we need to understand what HIV is. HIV stands for Human Immunodeficiency Virus. It's a virus that attacks the body's immune system, specifically the CD4 cells, often referred to as T cells. These T cells are crucial for fighting off infections. When HIV reduces the number of these cells in the body, it becomes harder to fight off infections and diseases. Now, you might be wondering, how does one know if they have HIV? Well, it's not always easy to tell. Some people might not show any symptoms for years. Others may experience a flu-like illness within 2 to 4 weeks after the virus enters the body. This can include fever, chills, rash, night sweats, muscle aches, sore throat, and fatigue. These symptoms can last anywhere from a few days to several weeks. But remember, the only sure way to know if you have HIV is to get tested. So, is there a cure for HIV? As of today, there is no effective cure. However, with proper medical care, HIV can be controlled. This is where antiretroviral therapy or ART comes into play. ART is the use of HIV medicines to treat the infection. It doesn't cure HIV, but it can dramatically prolong the lives of many people infected with HIV and lower their chance of infecting others. Now, you might have heard of something called post-exposure prophylaxis or PEP. This is a series of pills you can start taking very soon after you've been exposed to HIV that lowers your chances of getting HIV. But remember, PEP must be started within 72 hours after a recent possible exposure to HIV. Another treatment option is pre-exposure prophylaxis or PrEP. PrEP is a way for people who do not have HIV but who are at substantial risk of getting it to prevent HIV infection by taking a pill every day. To summarize, HIV is a virus that affects the immune system. Symptoms can vary widely, and the only sure way to know if you have HIV is to get tested. As of now, there is no cure, but with medications like ART, PEP, and PrEP, it can be controlled and managed effectively. Remember, the best defense against HIV is prevention. Always practice safe behaviors like using condoms during sex, getting tested regularly, and not sharing needles. It's a collective effort to end the global HIV epidemic, and every step counts. So, is an HIV cure possible? The answer is not yet, but with the advances in medical research and the ongoing efforts of scientists worldwide, the future holds promise. Until then, it's important to educate ourselves, stay protected, and support those living with HIV.